Nobody talks about this, and that's exactly the problem. Bathing is one of those topics that feels too personal, too obvious, too beneath the level of serious health conversation, so it gets skipped by doctors, by family members who don't want to say the wrong thing, by people themselves who assume what they've been doing their whole lives is probably fine. But the research tells a very different story. And the gap between what most people over 70 are doing and what dermatologists, geriatric care specialists, and skin health researchers actually recommend, that gap is wider than almost anyone expects. This video covers 7 facts about bathing that most seniors have never been told. Some of them are going to reframe something you've done automatically your whole life. A few of them are going to feel genuinely counterintuitive. And at least one of them is something your doctor has almost certainly never brought up. Not because it isn't important, but because there is never enough time in a 15-minute appointment to talk about the things that don't feel urgent until they are. So let's talk about them now. Before we get into the 7 facts, there's something worth understanding first. Because the reason most seniors are bathing wrong isn't carelessness. It's that the skin you have at 70 is genuinely, measurably different from the skin you had at 40. And almost no one explains that clearly enough for it to actually change behavior. Here's what's happening. Starting in your 50s and accelerating through your 60s and 70s, the skin undergoes structural changes that aren't visible in the mirror, but have enormous practical consequences. The outermost layer, the barrier that protects against moisture loss, bacteria, and environmental irritants, gets thinner. The cells that produce natural oils slow down significantly, and the skin's ability to hold on to water drops with them, and the microbiome, the community of beneficial bacteria that live on the surface and help regulate the skin's immune response, becomes less diverse and more easily disrupted. What this adds up to is skin that is fundamentally drier, more easily disrupted, and slower to recover than it used to be. The things that were fine in your 40s, a daily hot shower, a heavily fragrant soap, a rough towel dry, start to cause real cumulative damage in your 70s, not damage you necessarily see right away, but damage that compounds quietly, showing up eventually as chronic dryness, itching, cracked skin, increased infection risk, and in some cases, serious dermatological conditions that are entirely preventable. There's also a circulation factor that doesn't get enough attention. Aging skin has a reduced blood supply, which means it heals more slowly when disrupted. A small abrasion or a patch of irritated skin that would resolve itself in days for a younger person can linger for weeks in an older adult, and in some cases become a pathway for infection. None of this means bathing less is automatically better, or that bathing more is automatically worse. The relationship is more nuanced than that, and that's exactly what the next 7 facts are going to walk through. But the starting point has to be this. The rules that worked for your skin for most of your life don't necessarily apply anymore, and adjusting those habits, even slightly, can make a much larger difference than most people expect. That's the context. Now let's get into the facts. Fact number 1. For most people over 70, bathing every day is too much. That sentence is going to land wrong for a lot of people. We grew up in a culture where daily bathing isn't just normal. It's a marker of cleanliness, self-respect, taking care of yourself. The idea that doing it every day might actually be causing harm feels almost offensive. But here's what the evidence says. The American Academy of Dermatology, not a fringe source, the main professional body for skin health in the United States, recommends that older adults bathe 2 to 3 times per week rather than daily, not as a minimum, as the actual guideline. Their reasoning is direct. Daily bathing in older adults strips the skin's natural oils faster than they can be replenished, progressively compromising the skin barrier, increasing moisture loss, and triggering the chronic dryness and itch cycle that dermatologists see constantly in this population. The key phrase there is, faster than they can be replenished. In younger skin, the oil glands are active enough that daily bathing is roughly a wash. You strip some oils, they come back. In older skin, that replenishment is slow. Do it every day, and you're running a deficit that compounds. The skin gets drier, the barrier gets weaker, the itch gets worse. People respond by bathing more or scratching, which makes everything worse again. 2 to 3 times a week for a full shower or bath. That's the recommendation. Daily washing of specific areas, face, underarms, groin, is still appropriate. But a full body wash every single day is, for most older adults, doing more harm than good. If that's a significant change from your current habit, start with every other day and see how your skin responds. For many people, the chronic dry itching they've been managing for years starts to ease within 2 weeks. Fact number 2. Hot water is quietly damaging your skin every time you bathe. This one surprises people because a hot shower feels good, especially first thing in the morning, or when muscles are stiff, or when it's cold outside. The heat feels therapeutic. And to be fair, for muscles and joints, warmth does have genuine benefits. But for skin, hot water is genuinely harmful. The hotter the water, the more aggressively it strips the skin's lipid barrier, the thin protective layer of fats that sits on the surface and is your first defense against moisture loss and irritants. A hot shower can remove more of that barrier in 10 minutes than the skin can restore in 24 hours, particularly in older adults. Dermatological research on skin barrier function in older adults is consistent on this point. Repeated exposure to hot water ranks, alongside harsh soap and bathing frequency, as one of the primary modifiable drivers of the dry, compromised skin so common in this age group. The recommendation is water that feels warm but not hot. A useful test: if the water feels noticeably hot on your wrist when you first step in, it's too hot. Aim for something closer to body temperature, around 98 to 100 degrees Fahrenheit. It feels less dramatic than a hot shower, especially at first. But the difference it makes to skin health over weeks and months is substantial. And keep it short, 10 minutes or under. The longer you stay in, regardless of temperature, the more the skin barrier is compromised. The shower that feels like self-care can, past a certain point, be working against you. Those 2 changes alone, frequency and temperature, will do more for skin health than most products on the shelf. But there's more to get into. Fact number 3. Most soaps sold in drugstores are the wrong soap for skin over 70. This is one of those things that's hiding in plain sight. The soap aisle is full of products that are heavily fragranced, antibacterial, or formulated with surfactants, detergent-based cleansing agents that are genuinely too harsh for aging skin. They were designed for younger skin with a robust oil production system that can recover from aggressive cleansing. For skin in its 70s and beyond, they're stripping a barrier that's already running thin. The specific problem with fragrance is that it's one of the most common causes of contact dermatitis, an inflammatory skin reaction in older adults. It doesn't always show up as an obvious rash. More often, it shows up as persistent itching, redness, or a general sensitivity that people attribute to dry skin or aging when the actual trigger is sitting on their bathroom shelf. Antibacterial soaps are a separate issue. For healthy older adults who aren't immunocompromised and aren't in a clinical setting, antibacterial soap offers no meaningful benefit over regular soap for daily hygiene. What it does offer is a higher likelihood of skin irritation and, this is the part most people don't know, disruption of the skin microbiome, the beneficial bacterial community that helps regulate the skin's immune response and barrier function. What dermatologists actually recommend for older adults is a fragrance-free, dye-free, non-antibacterial moisturizing cleanser. Look for words like gentle, hydrating, or for sensitive skin on the label. Brands specifically formulated for sensitive or mature skin tend to use mild surfactants and include ingredients like glycerin or ceramides that support rather than strip the barrier. The price difference is often minimal. The difference in how skin feels and behaves over time is not. Here's something I'll admit directly. I made this exact mistake for years. I was using a bar soap, well-known brand, smelled clean, felt like it was doing the job. And I had this low-grade itching on my lower legs and back that I just assumed was aging skin. It wasn't until someone pointed me toward a fragrance-free moisturizing wash that I realized the itch wasn't inevitable. Within 3 weeks of switching, it was almost completely gone. I'd been treating the symptom, moisturizer, hydrocortisone cream occasionally, when the cause was the soap I'd been using every day without a second thought. The fix here is simple, inexpensive, and immediate. Check what's on your shelf. If it has a fragrance, even a light one, consider switching. Fact number 4. You have a 3-minute window after bathing that most people completely waste. The skin is most receptive to moisturizer in the minutes immediately after bathing, while the surface is still slightly damp and the pores are open from the warmth of the water. In that window, a moisturizer doesn't just sit on top of the skin. It seals in the residual moisture that's still present on the surface and gets absorbed more effectively into the upper layers of the skin. Wait until you're fully dry, fully dressed, and going about your morning, and that window is closed. The moisturizer you apply an hour later is doing a fraction of the work. The specific guidance from dermatologists is to pat the skin gently with a towel, not rub, pat, leaving it slightly damp, and apply moisturizer within 2 to 3 minutes of stepping out of the bath or shower. Full body, not just hands and face. Pay particular attention to the lower legs and shins, which have the fewest oil glands of anywhere on the body, and are the first place where serious dryness, cracking, and skin breakdown tends to develop in older adults. The moisturizer itself matters too. Creams and ointments outperform lotions for this age group. They have a higher oil-to-water ratio and provide a more durable barrier. Lotions feel lighter and absorb faster, which is why people prefer them. But for skin over 70 that's struggling to retain moisture, a thicker cream applied while the skin is still damp is significantly more effective. 3 minutes. It's a small habit change with a genuinely outsized payoff. Fact number 5. The bathroom is the most dangerous room in the house for adults over 70, and bathing habits directly affect how dangerous it is. Falls in the bathroom account for a significant portion of the serious fall injuries in older adults. The combination of wet surfaces, awkward positions, heat that lowers blood pressure, and the need to step over a tub edge or navigate a slippery floor creates a risk environment unlike anywhere else in the home. Most people know this in a general way. What they don't know is how specific bathing habits either increase or reduce that risk in ways that are entirely within their control. Hot water is part of this picture again. When the body is exposed to hot water, blood vessels dilate and blood pressure drops. For older adults, particularly those on blood pressure medication, diuretics, or any medication that affects circulation, this drop can be significant enough to cause dizziness or lightheadedness when standing up. The moment of stepping out of a hot bath or shower is one of the highest risk moments for a fall in this population. Warm water rather than hot reduces that vascular response meaningfully. Timing matters too. Bathing when tired, late at night, or when fatigued from medication schedules increases fall risk, independent of the bathroom setup. Morning bathing, when alertness and blood pressure are more stable, is generally safer for most older adults. And shorter sessions reduce cumulative heat exposure and the fatigue that comes with it. Research examining bathroom fall patterns in older adults has consistently found that modifiable bathing behaviors, including water temperature, session duration, and time of day, are significant independent predictors of bathroom fall incidents above and beyond the physical environment itself. In other words, the habits mattered more than whether there was a grab bar. That last point is worth sitting with. Grab bars and non-slip mats are important, but the behaviors happening inside the bathroom may be doing more to determine fall risk than the equipment. Fact number 6. Skin breakdown from bathing is a direct pathway to serious infection, and most people don't connect the two. Chronically dry, compromised skin, the kind that develops gradually from daily hot showers, harsh soaps, and skipped moisturizer, doesn't just itch and flake, it cracks, particularly on the lower legs, heels, and feet. And cracked skin, even small cracks that don't look serious, is broken skin. It's an open pathway for bacteria to enter the body. In older adults, the most concerning consequence of this is cellulitis, a bacterial skin infection that starts in the deeper layers of the skin and spreads rapidly through the surrounding tissue. Cellulitis in older adults is not a minor inconvenience. It frequently requires hospitalization and intravenous antibiotics. It recurs, and each recurrence leaves the affected skin more vulnerable than before. Actually, let me be more precise here, because I don't want to overstate the direct line. Not every case of dry, cracked skin leads to cellulitis. Many people have chronically dry legs for years without an infection. But the research is clear that compromised skin barrier is a primary risk factor for cellulitis in older adults, and that maintaining skin integrity through appropriate bathing habits and consistent moisturizing is one of the most effective preventive measures available. This isn't a remote risk. It's one of the most common reasons older adults are admitted to hospital for skin-related issues. The lower legs deserve special attention here. Thin skin, poor circulation, reduced oil glands. The lower legs are where barrier breakdown tends to start and where infection risk is highest. If you're noticing persistent redness, warmth, or swelling in that area alongside chronic dryness, that's worth a conversation with your doctor sooner rather than later. 2 more facts to go, and the last one is the one that completes the picture. Fact number 7. Bathing too infrequently has its own risks, and the line is more specific than most people realize. Everything up to this point has been pushing in one direction: bathe less, cooler, gentler. And for the majority of people watching this, that is the right direction. But this last fact matters because the picture isn't one-sided, and leaving it incomplete would be doing you a disservice. For older adults, particularly those with limited mobility, certain skin conditions, or incontinence, inadequate hygiene creates a separate and serious set of problems. Moisture trapped against the skin, from sweat, incontinence, or simply skin folds that don't dry fully, creates exactly the warm, damp environment that bacteria and fungi thrive in. Intertrigo, fungal infections, pressure injuries, these are the consequences of too little cleansing, and they are just as real and just as serious as the damage from too much. The guidance isn't bathe as little as possible. It's bathe the right amount, in the right way. For most healthy adults over 70, that means 2 to 3 full-body washes per week, with daily targeted washing of the face, underarms, groin, and any skin folds, using gentle, fragrance-free products, warm water, short sessions, and moisturizer applied immediately after. That combination, frequency, temperature, product, timing, is the full picture. Change one element and you get partial benefit. Get all 4 right and you're giving your skin genuinely the best conditions it can have at this stage of life. And here's what ties all 7 of these facts together. None of them require a prescription, a specialist, or any real expense. They require knowing something that most people were simply never told, and then adjusting a routine that's been running on autopilot for decades. Small adjustments with real consequences. Skin that stops itching. Nights that are more comfortable. A bathroom that's a little safer to be in. Those aren't abstract outcomes. They're the texture of daily life. And they're available to anyone willing to make a few quiet changes to something they've never thought twice about. Take care of that skin. It's been with you a long time.